In addition to the Solidarity Trial, I'm glad to say that WHO has convened groups of clinicians to look at the impact of corticosteroids and other anti-inflammatory drugs on treatment outcomes. Specifically, we're looking at oxygen use and ventilation strategies in patients. Any intervention that reduces the need for ventilation and improves outcomes for critically ill patients is important, especially in low-resource settings, to save lives. Last week, I announced the United Nations Supply Chain Task Force to scale up the distribution of essential medical equipment. Yesterday, the first United Nations Solidarity flight took off, transporting personal protective equipment, ventilators, and lab supplies to many countries across Africa. The Solidarity flight is part of a massive effort to ship life-saving medical supplies to 95 countries across the globe, in conjunction with the World Food Programme and other agencies, including UNICEF, the Global Fund, Gavi, the United Nations Department of Operational Support, UNITAID, and others, and Africa CDC and African Union. Whether it's by land, sea, or air, WHO staff are working around the clock to deliver for health workers and communities everywhere. I would like to thank the African Union, the governments of United Arab Emirates and Ethiopia, the JACMA Foundation, and all our partners for their solidarity with African countries at this critical moment in history. And I would like to thank President Ramaphosa and the chairperson of the Africa Commission, Moussa Faki, for their leadership. The Solidarity Response Fund has now generated almost $150 million from 240,000 individuals and organizations. This Saturday, some of the biggest names in music are coming together for the One World Together at Home concert to generate further funds for the Solidarity Response Fund, but not just to raise funds, to bring the world together, because we're one world, one humanity, and fighting a common enemy. And I thank Lady Gaga, the Global Citizen, and all that are participating in putting this concert together. We will continue to work with every country and every partner to serve the people of the world with a relentless commitment to science, solutions, and solidarity. I repeat, with a relentless commitment to science, solutions, and solidarity from WHO. Since the beginning, WHO has been fighting the pandemic with every ounce of our soul and spirit. We will continue to do that until the end. That's our commitment to the whole world. I thank you.
Thank you very much, Dr. Tedros, for these opening remarks. As you know, we do send these opening remarks with the audio file after the press briefing, but even before that, these remarks are posted on our website under section speeches of the Director General, if you wish to get them a little bit earlier. We will open the floor to questions, but please make sure that your questions are short, and we will take only one per person. So if we are ready, we will try to go first to Dawn Kopetsky from NBC. Dawn, can you hear us?
Yes, can you hear me?
Yes, please go ahead.
Hello, can you hear me? Hi, thank you for taking my question. My question is about funding. How much exactly does the United States government, not including the Gates Foundation or private contributions, the government provides to WHO a year, how much have they already sent you, and how much is at stake that Trump is withholding or threatening to withhold? How does that affect your program?
So I have said it in my statement. We're assessing how our programs will be affected. And not only that, we will try to fill any gaps with partners. So we will get back to you after our assessment is completed. Thank you.
Thank you very much, Dawn. Let me just see, who do we have next in line? Yes. So we will go now to our colleague from Geneva Press Corps, John Zagacostas, who works for Lancet and France 24, if I'm not mistaken. John, can you hear us?
Yes, I can hear you. Can you hear me, Tariq?
Yes, please go ahead.
Yes. Good afternoon, Dr. Tedros. I was wondering, sir, you just mentioned you're looking at the assessment on the shortfall in funding. Looking at your 2020-2021 budget, it looks like the shortfall will be around $115 million from the United States for 2020. Can you get the money from partners, or will you be forced, as you're allowed under WHO rules, to transfer funds from other programs up to 5% of earmarked funds? Thank you, sir.
So I will repeat what I said again. We will do the assessment and then announce it officially. Thank you.
Thank you very much, Director General. Now we will go to also our friend who is often here in Geneva, Shoko from NHK. Shoko, please.
Hello, Tariq. Can you hear me?
Yes, we can hear you.
Okay. Dr. Tedros, U.S. Department of State says early information by Taiwan on isolated treatment in Wuhan was withheld from global community by WHO, and they also criticized WHO for choosing politics over global health. How do you respond to such criticism? Thank you.
Best, but I think the question was about Taiwan and isolating Taiwan.
Maybe I could just clarify on the technical. Maybe Steve or want to take up the issue around working with Taiwan. But the specific issue of reports, there were multiple sources of reports on the 31st of December regarding a cluster of cases of atypical pneumonia in Wuhan, China. In fact, they emanated from a press release or a publication on the website of the Wuhan Health Authority. And it was from that publication that many agencies, including our own epidemic intelligence from open sources and I believe ProMed, I believe others, picked up on that. And there was a flurry of communications between various agencies to verify that signal. It was WHO then who moved to formally verify that signal through our country office with the government authorities in China.
Just maybe to introduce, we have our colleague Steve Solomon, Principal Legal Officer, who will also add something on this topic.
Thank you, Tariq. Let me address this larger issue of the question that was just asked. I'd like to do so in two parts, by addressing on the one hand WHO's technical health mandate, and on the other hand WHO's status as an international organization composed of countries. On the one hand, there is WHO staff, the doctors, the scientists, the researchers, among many others. They focus on technical and operational public health work. On the other hand, there are the countries, that is the member states. The member states decide on the political issues like membership, like observership, and these 194 member states of the World Health Organization, they set the policies of the organization. And in that connection, the policies of the organization, it's important to understand that WHO is very much part of the United Nations. In 1971, the countries of the United Nations decided to recognize the People's Republic of China as the only legitimate representative of China. 1 year later, in 1972, the member states of the World Health Organization decided in Resolution 25.1 to do the same thing. And this has been the official position of the United Nations since 1971. WHO is the specialized health agency of the United Nations, and as such aligns with the United Nations and must do so coherently. So we are in the hands of countries on these issues. WHO staff doesn't have the mandate or power to change that. Our mandate is to work to promote the health of all people everywhere. We do this, again, as described by the DG, without distinction of race, religion, political belief, economic or social condition. This is part of the DNA of the organization. It is literally written into the opening paragraphs of the WHO Constitution. This means we work with and for all people everywhere, whether they are in Taiwan, China, or any other place. So I'd like to provide some examples of the well-established arrangements for Taiwan's health experts working with WHO. I'd like first to give 5 examples of activities in the context of the COVID-19 response, and then 5 more examples of activities in a wider context. So 10 in all, but I will keep this concise. So in the context of the pandemic, first, for the international health regulations, the IHR, Taiwan has a formal point of contact, a focal point. The IHR is the international treaty which guides and regulates the global health response. Taiwan's IHR point of contact receives communications and provides information directly to WHO headquarters. It also has full access to the IHR Event Information Site System, and in a recent development, all IHR contact points have access through that system to the weekly information sessions from headquarters. Second, their health experts participate in 2 key WHO networks set up in January to support WHO's work in the global response. 3 of their experts are part of WHO's IPC network, the Infection Prevention and Control Network. 2 of their experts are part of WHO's Clinical Management Network. And every week, they join a WHO teleconference, sometimes twice a week, with scores of other experts from around the globe working to advance our knowledge and our guidance in the response. Third, 2 of Taiwan's health experts participated in the WHO Global Research and Innovation Forum that was organized in mid-February, with scientists participating from around the world. Fourth, WHO has briefed and discussed their response with their health authorities in Taipei. Dr. Van Kerkhove and I spoke with them by phone in February and again earlier today, and work is underway to do so again. And Dr. Van Kerkhove may want to comment on that in a moment. Fifth, WHO also interacts with their health authorities through the European Centers for Disease Prevention and Control. So those are some examples related to the pandemic. There are 5 additional examples I'd like to share with you on a range of other health-related issues. First, over the course of last year, 2019, Taiwan's experts attended 8 WHO expert meetings, more than 1 every other month. The issues they worked on included immunization, drug-resistant TB, vaccine safety, non-communicable diseases, and mental health. And work is underway for more of this kind of expert participation in 2020 as well. Second, on influenza, a Taiwanese vaccine manufacturer, Adimune Corporation, contributes to the WHO Pandemic Influenza Preparedness Framework. The PIP framework is a critical access and benefit sharing framework for pandemic flu. Third, in the fight against cancer, their experts have contributed articles published in WHO's International Agency for Research on Cancer publications. Specifically, their articles have appeared in the authoritative WHO IARC Blue Book on classification of tumors. Fourth, in support of the IHR mechanisms ongoing, one of their leading public health experts is included in the prestigious IHR experts roster. And fifth, on issues from pharmaceutical manufacturing to malaria, we have exchanges on practical and technical issues. So those are 10 examples that underscores the principle that WHO works with all people everywhere. I'd like to add that this work contributes to WHO, to the response, and to WHO's work in many areas of global public health. I hope that this information clarifies how WHO works together with Taiwan's experts and health authorities, and I'd like to offer to Dr. Van Kerkhove any opportunity to comment on today's discussions. Thanks.
Thank you, Steve. So just briefly, yes, I had the opportunity to brief scientists and public health professionals from Taiwan, and it's always a wonderful opportunity to exchange with any frontline workers, anyone who's involved with this pandemic, to learn from them, to exchange information, and how all of this information adds to our understanding of this previously unknown virus. So there were 2 exchanges that I personally participated in, and I'm very grateful for that. They also participated in our clinical networks and our infection prevention and control networks, again, having a direct exchange with peers from all over the world. And that is another example of how WHO brings together people all over the world to share experiences, which is always very critical early on in an epidemic or pandemic when a lot is unknown. And so this is a great opportunity to be able to exchange and learn and feed that into our guidance. So that's what I would like to add. Thank you.
Thank you very much for this comprehensive answer. This was Steve Solomon, WHO Principal Legal Officer. We apologize that we didn't have a nameplate, but we will surely send the name when we send out the audio file. We will now continue with questions. We go to a Russian news agency, Interfax, and we have Irina with us. Irina, can you hear us?
Yes, can you hear me?
Yes, please go ahead.
Are you planning to discuss the budget issue with other countries, particularly with Russia?
Irina, can you please repeat the question? We only understood, did we discuss with Russia, but what exactly?
Yeah, are you planning to discuss the budget issue with other countries, including Russia?
Thank you.
The WHO, as part of its governing bodies, has a number of mechanisms for discussing budgets with our member states, and our programme budget committee, our executive board, and the World Health Assembly itself. And I'm sure in the coming weeks and months, those opportunities will arise as those governing body meetings emerge. As the Director General said, we are laser focused on doing a very important job right now, and that is suppressing this virus and saving lives.
Thank you very much. Hope this answers the question that came from Irina, Interfax agency. We will now go to Chile. Marcelo from Chile, El Pingüino newspaper. Can you hear us, Marcelo?
Hi, hello, how are you? Can you hear me?
Yes, we are all very well. Please go ahead, Marcelo.
Thank you so much. Good morning, doctor. In Chile, there is several cities in quarantine. Many will be 20 days old. My question is it recommendable to keep this measure thinking about the population mental health?
Thank you. If I understand your question, you said, is it okay to keep these measures while considering people's mental health? And that's an important consideration. There is no doubt that restrictive measures, stay-at-home orders, restriction of movement has been quite isolating for people, and all the more isolating for people who are already isolated or vulnerable. And therefore, as we have always said, lockdowns in their own right are not a solution, but they have those population-wide physical distancing measures have proved quite effective in countries where there has been a rapid escalation of cases sometimes as a result of not being successful in containing the disease in the first place. Those measures have served to suppress some of the transmission. We have said in our strategy that was released yesterday, and we'll be releasing further technical guidance later today, tomorrow, on the transition strategies that countries have. We do note that in Chile and in other countries in South America, there's been an acceleration in infections, and it did require measures such as that. But those measures need to be replaced with strong public health intervention, case finding, testing, contact tracing, quarantine, community engagement, and in some ways a new norm where communities, all of us, are going to have to adapt to new ways of behaviour, new ways of interacting with each other, while we continue to suppress the virus and while we search for a vaccine and therapeutics that will help us to truly suppress both the number of cases and the mortality associated with this virus. Mental health, we have issued guidance on mental health and how to manage mental health. It's been one of the big issues, as you've seen in social media. There's a huge outpouring of support for people. I think communities are supporting each other. There's been an incredible outpouring of solidarity between people. And while we may be physically isolated, I actually have seen amazing stories of us not being socially isolated. It is tough, it's not easy, and it's something we must endure, and we must endure it until we have in place the other measures to suppress this disease. So we've said it very clearly to governments. We must work really hard now to accelerate the investments we need in public health infrastructure, in community engagement and education, and having a hospital system capable of dealing with cases. If we do that, we will be able to make our way out of these more draconian lockdowns. And this is something that the World Health Organization wants so badly with the rest of the world.
Yes, thank you. So as you've heard us say, we've stopped saying social distancing. We've been saying physical distancing because it's important to remain physically separate but socially connected. And there's a lot of ways that you can look after your own mental health and the mental health of your family during these very difficult times, whether you are adhering to a stay-at-home order or you are isolated yourself. There's a lot of things that you can do. There's no lockdown on laughter. There's no lockdown on talking to your family and finding ways to connect. And especially through different religious periods that are coming up, there's ways in which you can connect with family using technology that you may not have used previously. Make sure you exercise any way that you can, whether it's at home and doing a class, whether it's doing yoga, something to keep yourself physically active. Make sure if you meditate, find ways to meditate or find ways to turn the news off, and have some time for yourself. Listen to some music, read a story, play with your kids. Just find ways in which you can remain socially connected with others while you're remaining physically apart.
Thank you very much, Dr. Van Kirchhoff and Dr. Ryan. From Chile, we go to Pakistan. We have Niha Dagia from Express Tribune. Can you hear us, Niha?
Hi, Chris. My question is, there's a looming threat of the virus spreading in the slums, but Pakistan's negative to positive ratio is quite high. What do you think the government can do to ensure that it is testing the right people? And do you think that the WHO influenza surveillance can help in detecting community spread?
Certainly, taking your second question first, there's no question that influenza surveillance systems not only can be used in detecting community spread, but are being used very much all over the world and are proving very effective at picking up signals that the disease is at community level. Maria can speak a little bit more on the numbers around that, but the SARI, or ILI surveillance systems that have been developed over the years by the Global Influenza Surveillance and Response System, which has been in place for over 50 years and has protected the world against pandemic influenza. And certainly much progress has been made in retooling that system to keep a sentinel watch as the disease spreads in communities, and that whole system is now capable of doing systematic testing. Not only is it testing all its samples for influenza. It's also testing those samples for SARS-CoV-2, which is the virus that causes COVID-19. With regard to Pakistan itself, it is a challenge in a country like Pakistan. I spent 2.5, nearly 3 years in Pakistan working on polio eradication. I've been in Karachi, I've been in Lahore, I've been in Baluchistan, I've been in Peshawar, and in working in some of the poorest communities on polio eradication. And I personally know the challenge that Pakistan faces in delivering an effective public health intervention in those circumstances. The structure of the response in Pakistan is quite well laid out with the National Disaster Management Agency. I know that the polio program in Pakistan has been very much retooled to support the response there, but there are limitations. In the slums in Karachi, it's very difficult for people to social distance. Lockdowns do cause hardship, and it's really important that government, NGOs and others are working to support local communities when they are suffering both the threat of COVID, but also the consequence of restrictions of movement and other things. Pakistan continues to carry out good surveillance and has had one of the most effective surveillance systems for polio in the world. And not only a surveillance system for the virus, but has been doing extremely good environmental surveillance and other surveillance for polio viruses over a large number of years. The National Institute for Health and the Aga Khan University and others are very competent research outfits, and there are great public health leaders in Pakistan, like Rana Safdar and many others, who can offer the leadership that Pakistan needs on the science side. And we trust that the government is coming together, both at national and provincial level, to provide the kind of leadership needed. Thank you.
So to add to that, so yes, we initiated a pilot study a few months back, or a month back, which was trying to utilize the existing respiratory disease surveillance systems in countries for COVID-19. So in countries all across the world, there are national influenza centers. These are the laboratories that test for flu and for other respiratory pathogens, to use that basis to test for COVID-19.
All right, so we're going to have come out of that press briefing there, much anticipated. Dr. Tedros Ghebreyesus, the WHO Director General, responding to the US withdrawing its funding, saying that he hopes that the President reconsiders this because it's been a long-standing, generous friend of the WHO, and he says that they're looking at the impact of the withdrawal of this funding and working with its international partners to make sure that the WHO's work continues regardless of this decision. All right, as I say goodbye, thank you very much for watching. We're going to cross now live to the MultiChoice building in Randburg, just north of Johannesburg,